What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we'll cover how many medical workers do you need to run an ER during a night shift. So, I am an X-ray tech, been doing it for 4 years, night shift, 7 on, 7 off. I do dabble in day shift, a lot of overtime. So this is for both X-ray and if you're curious about workers in general, like the other health profession. So for night shift at my joint, it's me and another tech for the X-ray crew. There's 2 of us. And then we have CT, that's the next, and then 1 CT and then 1 ultrasound. That's like the whole radiology squad right there. And then outside of that, you will have typically anywhere between 6 to 7 nurses that are in the ER, and then 1 charge nurse. And then typically, as far as doctors wise, you'll have like what we call the head of the ER. It's like one of the top doctors, who's usually the one who's been there the longest, will be the top doctors. And then you'll have another doctor under the top doctor, and then you'll have usually like 1 or 2 nurse practitioners that are also working in the ER. So that's kind of will take care of the whole medical squad there. And then you have typically 1 respiratory, sometimes 2 if they're busy. And then the psych unit has like 2, I guess, like psych assistant for the nurses, usually 2 there. And then you have like 1 dedicated security that stays in the ER. And then of course you have like your receptionist people. So it's like 1 receptionist and then 1 nurse in the front over there. And then you have like the cleaning crew who cleans like the ER and helps the nurse. And that's kind of about it. That's like your whole night shift crew. And then of course, like for day shift in the ER, we typically, depending on certain days, like if it's the weekend, you have 3 X-ray techs in the day, and then it's 3 CAT scan. 3 to 2 CAT scan techs will run also. And then ultrasound, once again, it's just like 1 or 2 for ultrasound. And then during the week in general, you'll have between 4 to 3 X-ray techs that'll hold down the ER. And then you'll have like 3 CAT scan people in the ER, and then once again like 3 ultrasound that will come and go and stuff like that. I'm not sure about MRI and all them because they really don't come there to the ER. I don't really get to see them. And then I mean nursing staff and all that, you could basically double it for night shift, like the amount. And then you have probably 3 to 4 respiratory people who are in there. And then as far as doctors, you may slap on maybe 2 extra doctors and then like 1 extra nurse practitioner who will help you there. And yeah, that's kind of about it. That's what it takes to run an ER. And then I mean, depending on like the workflow, or if we're going on divert, or if it slows down, they may send. Like if it slows down, typically what will happen is they'll send all the nursing and maybe some of the doctors who've been there kind of longer will kind of leave. And then it'll just, usually if it's like really, really slow, it'll just end up being like 1 doctor and 1 nurse pract who will hold it, and then probably 3 nurses. That's the lowest staff DD I've had that I've worked with. And yeah. Hope this is informative, and see you on the next one.